Hey everybody, good morning. Welcome to our monthly advocacy webinar being broadcast from a sleety, snowy location here in Alexandria, Virginia. Greatly appreciate, as always, people taking time out of their day to get our last advocacy webinar of the year, kind of a wrap up of what this year has brought on. Let's start with a quick update of the rollout of the COVID vaccine. And I'll preface by saying, as always, if anybody has any questions, please do type them into the chat box, and I will get those read so that we can get to everybody's questions. I know that I have gotten a few questions on the COVID vaccine, as has Joe McDonough over this week. So we've gotten, like I said, a few calls looking for guidance on where orthotists and prosthetists fit into this rollout. You'll recall that AOPA reached out to HHS and the CDC to ensure that our members could be among the first to receive the vaccine. And while we never received an official response, it does seem like our suggestion was heard. In most cases, you're viewed as frontline workers by HHS and the CDC. CDC guidance issued just a few days ago notes, as you would expect, that healthcare workers should be first in line to get the vaccine. That doesn't necessarily mean that you'll be first in line in your state. Individual states continue to roll out and clarify their protocol for disbursements of the vaccines per the CDC recommendations, but everyone is different. You know, the CDC offers recommendations and makes suggestions on how this should be done, and states and individual localities take action on those and roll those out. But in New Hampshire, for example, so these are the New Hampshire guidelines, which were published this week. You can see here they specifically name O&P as a high-risk healthcare worker, and therefore that O&P has early access to the vaccine. So again, you know, CDC guidelines state that orthotists and prosthetists should be part of that first wave of healthcare workers. But if you have questions about your state, by all means, reach out to me. You can consult your state's Department of Health website, as by now they should have updated information. We are happy to help in any way we can to ensure that you're getting your vaccine. However, I should note, field 2 calls this week from people asking where they should go to get their vaccine, and I'm afraid I can't help with that. Each state is different. As I said, each state is handling their vaccination sites in different ways, so it's really up to, so I can tell you that you should be first in line, and you shouldn't get any pushback. And again, reach out to me if you have any issues, but in terms of you know, where you should go to get that, I'm afraid I can't help there. But the good news is that you should have access to that. Similarly, we have gotten calls from folks who are contracted with the VA to ask if that contracting relationship with the VA gets them early access. I mean, it doesn't, but you have early access by virtue of the fact that you're an orthotist and prosthetist, you're in a high-risk category. But at this time, the VA doesn't have any guidelines on the rollout for contracted medical personnel, just veterans and healthcare workers within the VA system. Once we've gotten some guidance, some additional guidance from CDC, from the VA, I will make sure that we get that out as soon as we can. So hopefully that you guys on this call and our members can get vaccinated quicker. I will, obviously this is not government relations technically related, but I will pause there just to see if anyone has any questions before we move on to the actual lobbying government relations side of things.
Yeah, Justin, it looks like you have a question. What about the classification of O&P manufacturers and or technicians in the vaccine rollout?
So that is another one we're trying to get some clarification on. As I understand it, and I don't want to jump to conclusions and I don't want to give anybody false hope, but as I understand it, manufacturers are also included in that original protocol, despite the fact that they're not healthcare workers. But I am looking for a specific guidance from CDC on that, which we are waiting for. That's a great question. Sorry, I should have mentioned that. But we expect clarification on that very soon. Any other questions?
That's it for now.
Okay, and by all means, weigh in if you have any. If something comes up over the course of the webinar, please do weigh in with questions. So unlike our last webinar, which was literally the day after the election, we now know who the next president will be, as Joe Biden's win was certified earlier this week. But before we start talking about his cabinet, I want to remind you that while the presidential race is over, we are still not done with elections. We still have 2 Senate races to go, and very important Senate races, both in Georgia. Those will determine control of the Senate. Right now, the Republicans have a 50 to 48 lead. Thus, if the Democrats are able to win both of those Georgia Senate seats, they will control the Senate by virtue of Vice President Kamala Harris's tie-breaking vote. when she presides over the Senate. So it would be a 50-50 split if Democrats win both, but the Democrats would have the majority because of Kamala Harris's tie-breaking vote. The first race, and I'm sure you've been hearing about these races ad nauseum, so I'm probably not telling you anything you don't know, but the first race pits incumbent Senator David Perdue against Jon Ossoff. As you probably know, Perdue failed to hit the 50% threshold on election day. That necessitated this runoff. This was a race that Perdue was expected to win, but he had made some questionable stock trades over the past year. There are numerous reports that he has profited from inside information during this pandemic. He's argued that that's not true. Others have argued that even if it is true, that is fairly common practice among elected officials, which sadly it is. But it is hurting his poll numbers. As you can see here, he once had a lead, and that has trickled to a very small deficit, though well within the margin of error. The other race is Kelly Loeffler, who is technically the incumbent. She was appointed to fill the remaining term of Senator Johnny Isakson, who retired last year. She is in a race against the Reverend Raphael Warnock. Loeffler has proven to not be terribly popular either as a candidate or as a senator, frankly. Trying to fill the shoes of a guy like Isakson, who is very, very well liked on both sides of the aisle, has not proven to be easy. And I'll tell you, numerous Georgia Republicans that I've chatted with, not members of Congress or staff, but just people who live in Georgia, have said they'll vote for her. They'll hold their nose and vote for her, but they think she's fairly ineffective. They don't like some of the campaign ads that she's running, which don't really tell you anything about her. It seems to be all attack all the time. And I think obviously in both of these races, we have the added issue of a sitting president, questioning the integrity of the elections in Georgia, not just writ large, which he has been, but in Georgia specifically, calling out the Georgia Attorney General, the governor of Georgia. And that may very well serve to keep Republicans home. Republicans are finding they have a very hard time having it both ways in the state. They have said, and Perdue has said, and Loeffler has said that the election was rigged, yet they're also saying everyone should go out and vote in the Senate race. And the mixed messages are causing a little bit of chaos in this election, as you can imagine. So it'll be very interesting to see how this plays out and what Republican turnout is. And that really all does come down to Republican turnout. If they can keep the numbers that they had for the presidential election, they should be fine and win at least one of these races. But if those numbers are diminished, they could hand Democrats both of these seats. So that will be interesting. Switching gears a little bit, let's talk about some of the president-elect's cabinet choices so far, or at least the ones we know of. Of course, they are still being named almost daily. I will preface by reminding everyone that we're distinctly nonpartisan on these webinars. I strive to be nonpartisan and not take sides either way. I am just going to tell it like it is. But on that note, the rollout of Biden's cabinet choices, at least here in the Beltway, has not gone particularly well. Not only who they are, but the way they've been announced. I'm going to use the Agriculture Secretary as an example here. It seemed clear that two women were in the hunt for that cabinet position: Heidi Heitkamp, a senator from North Dakota, and Congresswoman Marcia Fudge of Ohio. Both of those women were deemed great choices. The prevailing wisdom was he would choose Fudge and make history by having the first African-American Secretary of Agriculture. But either way, the prevailing wisdom was there would be a woman in that role. Instead, he not only chose a white man, Tom Vilsack, he chose someone who had held this same job under Obama. So it wasn't particularly an inspired choice. Not that they all need to be, but it was interesting how generic that choice was. Now, on the one hand, you couldn't ask for someone who's more knowledgeable about that role. He did it, and he did it well for a number of years. But teasing the other two names, having those other two names leak a little bit, and then going with the status quo ruffled a lot of feathers. He did eventually choose, as some of you probably know, he chose Marcia Fudge for Secretary of Housing and Urban Development, but she was already in talks for that position as well, so that didn't really fix the problem. The same pushback happened when he chose Denis McDonough to lead the VA. There was a lot of talk about Mayor Pete in this role, or at least someone with some military experience. McDonough has none. Biden's decision surprised the veteran service organizations. We're in close contact with the VSOs here in DC, and I've talked to a couple of people who are very surprised by the choice of Denis McDonough. He was McDonough, for those who don't know, is a longtime Capitol Hill staffer. He joined the Obama campaign in 2008. And then he served in various foreign policy roles in the White House, finally becoming chief of staff to President Obama. But he has, like I said, no military experience and not a lot of direct experience with the VA. So it'll be interesting to see how this plays out. And obviously, since I mentioned Mayor Pete, you probably saw that just yesterday he was tabbed to be Secretary of Transportation. So he will be in the Biden cabinet, just not in the way we thought he would be. He'll be leading, taking on one of the biggest departments in the federal government. There are 55,000 employees of the Department of Transportation. That's literally half the population of South Bend, Indiana. So good for him. He's used to working with a lot of people. Equally surprising, but certainly less controversial, is the choice of Xavier Becerra to be the Secretary of Health and Human Services. Becerra served 12 terms in the House of Representatives, representing parts of Los Angeles. Equally important, he spent the past 4 years back in his hometown of Sacramento as the Attorney General of California, where by and large he has met with very positive reviews in the job that he's done. And, more importantly, he serves as Attorney General as sort of that intersection between the state of California and Health and Human Services. So not a choice that a lot of people thought was going to happen, but certainly one that has been by and large welcomed inside the Beltway. Most people think he's going to do a great job. We actually, coincidentally, were on a Zoom with Attorney General Becerra just a couple of weeks ago. Which was interesting because we were on the same Zoom call that we were on. New Mexico Governor Michelle Lujan Grisham was on that Zoom, and prevailing wisdom around the Beltway was that she was going to be picked for the HHS job. You can read the gossip on this if you want to, but essentially what seems to have happened is she got a little overconfident that she was going to get that job and started talking as if she was already tabbed for the role, and it seems like it turned some of the Biden transition team off. And so her name was kind of pulled at the last minute. So it was interesting that we were on a call with who we thought was the presumptive HHS secretary. It just wasn't who we thought it was going to be. But we have a long-standing relationship with Attorney General, soon-to-be Secretary Becerra. He has been an ally of OMP. So in our minds, this is a great choice, and we're very much looking forward to working with him. One more choice that Biden has made that, should it happen, will probably benefit ONP. But this one will be the hardest to get through the confirmation process, and that is Neera Tanden, who's been tabbed to head the Office of Management and Budget. Neera Tanden is a longtime aide and a close friend of Hillary Clinton. She currently heads the Center for American Progress, which is a left-leaning think tank here in DC. She manages to be that rare cabinet pick that sometimes happens, who is going to rile folks on both sides of the aisle. To former Bernie Sanders staffers and allies, she is one of the people who helped sink, at least in his mind and his followers' minds, sink his 2016 campaign behind the scenes. Not to mention, again, in their eyes, she's a union buster. She's a threat to Social Security. She's a person who picks fights with those on the far left. Again, these are words of the Sanders supporters. And of course, the folks on the right won't necessarily like her, because the Center for American Progress has not been at all shy about championing, so-called left causes. But I will say that for us, this is another pick that, should she prevail, is good for us. She has been someone. She'll be the first OMB administrator who or first person charged with setting a federal budget, who grew up in Section 8 housing. She grew up on food stamps. She's a person who kind of understands ways that the federal budget could be carved out to help the people who need it most. And she most definitely understands the need for funding programs that help the disability community. That's a huge part of what the Center for American Progress does. I've worked very closely with their staff on various programs. A lot of staff from the National Council on Disabilities under Obama left to be part of the Center for American Progress. So they're doing good work overall, and so it'll be good to have that knowledge that she has at the head of OMB, assuming, of course, that she can get there. It'll be a very tough road for her to get confirmed. There's always one or two that the opposition in the Senate will bear down on and really give them a hard time trying to get confirmed, and I'm pretty sure it's going to be this one. So let's talk about what is left and what we might see in the next Congress, and what we are going to look for in the next Congress. I think before we do that, we should probably cover what is left to do in this Congress. We got reports last night that there is agreement on a COVID relief package. You've probably been reading those same reports. This one is much smaller than Democrats were hoping to get before the election, and even just a couple of weeks ago, actually. So the package that is being kicked around on DC, in DC, again, we don't have actual verbiage on this. We don't have an actual copy of this, but the draft that is being kicked around is looking to be about $900 billion, which obviously seems like a lot, but the Dems, of course, had passed a $3 trillion plus package earlier this year, and the numbers that they were seeking prior to the election were much higher than $900 billion. So it seems like this, where they landed is a little bit closer to where the Republicans were hoping. There will be, it looks like there will be direct payments to taxpayers as a result of this bill. Taxpayers of a certain income, of course, likely around a $600 per household check, not the $1,200 that folks got last time. But interesting to note that Republicans, that it looks like in this package, Republicans gave up their biggest ask, which is a liability shield, and Dems gave up their biggest ask, which is another round of state and local funding, all for the goal of keeping the price tag down. Again, this proposal is still being worked on. I don't have the specifics, but it seems unlikely, given the smaller size of the bills that they're talking about, that it looks like we might have a hard time, AOPA might have a hard time getting in some of our priorities into this package. They are really trying to keep this as slimmed down, or at least as slimmed down as a $900 billion bill can be, without a lot of extraneous measures, nothing that could hold it up. And of course, our bill, which I'll talk about more in a minute, as I've talked about on every webinar, it's bipartisan, got broad bipartisan support. It is not controversial. But some members have articulated, and they're not wrong, that the provisions that we're seeking don't exactly relate flawlessly to COVID, and for that reason, it's unlikely that we'll get provisions that we want into this COVID package. Doesn't mean we don't have other opportunities to move it before the end of this term, but unlikely to end up in this COVID bill. And again, we'll talk more about our priorities in a minute. Talking about the next Congress, though, and at least some of their priorities, that new Congress, the 117th Congress, begins on January 4th. The number one thing will still be the virus. Even if they're able to get this next package across the finish line, there could be more outstanding things to get done that are COVID related. I would definitely not expect another large COVID relief package. It took them 7 months to get this one done, if they can get it done at all, of course. So they won't go back down that. They won't go back to that well. I can promise you that. House Democrats will view having Biden as president as a green light for some of their priorities, which will include a massive infrastructure package. I can almost guarantee you that will happen sometime early next year. They'll introduce legislation to lower prescription drug costs, enhancing voting rights, and increased election security. Their argument will be, well, if everyone thinks these elections were rigged, let's do more to ensure that more people can vote. Let's make sure that there's security around these elections. So they'll work for legislation that does that. And it'll be hard for the Republicans to argue, given some of the arguments they've made against some of the this past election. So they'll also be looking at protecting the Dreamers, which is to say legal protections for qualified undocumented immigrants who were brought to this country illegally as children. Even though, and that seems like it's also got increasingly bipartisan support. So they may actually be able to get those protections done, knowing that they don't have any sort of a veto threat and obviously a very different president hanging over them. And even though they know that most of this type of legislation will be dead on arrival in the Senate, they will almost certainly work on gun control and climate change legislation. A lot of members campaigned on that. All that said, remember that contrary to what I thought would happen, what I told you would happen during our pre-election webinar, the Democrats did not gain any seats in the 117th Congress. In fact, they lost 10. So their majority is even smaller. And some of them are still, some Democrats won some very tough, purple districts. Making that gun control and climate change, any of those gun control and climate change bills, even tougher to pass, certainly tougher to predict. So we'll have to see how those play out. And again, of course, any of that legislation is likely dead on arrival in a Republican Senate. If the Democrats can win those 2 Georgia seats, that changes things dramatically. But I would not look at them to focus, if the Republicans win even one of those Georgia seats, I would not look at the Democrats to focus on gun control or climate change in any sort of big way. Writ large, though, I think you'll see a lot of what we saw in terms of non-COVID legislation this year. The House steadily cranking out Democratic-led bills that pass on party lines, which then go to the Senate to languish and likely eventually die. But I do think infrastructure, drug costs, surprise medical billing, these are and protecting dreamers, these are bipartisan issues that will get traction and do have a chance of getting done. Which brings us to our priorities. Of course, we will have the Patient-Centered Care Act, and I'll talk about that in a minute. But we also do have other priorities that we are going to try to get in this COVID package, and if it's not done in this COVID package, at least early enough next year, to provide some relief to our members and our providers. Specifically, as we have been fighting for since the outbreak of, well, not since the outbreak of the pandemic, but at least since the Paycheck Protection Program was instituted, we need tax relief on the Paycheck Protection Program and the provider relief funds. Many of you got payouts from one or both of those. We are coming up on the time of year when you are starting your tax planning, and we want to make sure you don't have to pay taxes on the funds you received. Just because you were trying to operate at full capacity, keep your employees and help your patients. It's not fair to give you that money to help you stay afloat and then put a tax burden on it. So that's our argument we've been making from the inception of those programs. We'll continue to fight for a tax exemption for those, for that money. We also want to make sure that all the PPE you buy is exempt from taxes as well. Yes, obviously we have a vaccine and that's great news, but it will be in the middle of the year, next year, before it's widely available. And until then, we want to make sure our members get the help they need. So you can be safer while you're in office, so your patients can be safer. Avoiding putting a tax break on the PPE that you're buying is also something we're fighting hard for. And we'll continue to fight through the end of the pandemic. I mentioned the Patient-Centered Care Act. We have fought very, very hard for that this year, all four facets of that bill, and especially the separation of OMP from DME to be included in a COVID relief package. Again, I don't anticipate that will happen in this bill. It's not just us. There are many other medical groups, any other number of lobbyists that are trying to squeeze round pegs into the square holes of this bill and kind of get last minute things done. But it is clear that Congress does not want this to be a Christmas tree. They want it to be lean. That doesn't mean we will give up on trying to get facets of the OMP Patient-Centered Care Act into a final bill. There does still need to be some sort of omnibus passed, or at least a continuing resolution to fund the government into early next year. So to avoid a government shutdown, which I believe would be at the end of this week if they can't get something done, or maybe early next week. So there's another vehicle we can use to try to get our language in there, but we'll keep arguing until the last train leaves the station on the Patient-Centered Care Act. The good news is we have all the champions on the House bill, all the champions in the Senate bill, all have been reelected, all are coming back to Congress, and all of them have committed to reintroducing the bill. So instead of waiting until November for the House bill, as we did in 2018, and waiting until August of this year to get a Senate bill, which we did on the Senate side, those bills will probably come out March or April, giving us a much, much longer timeline to get them done, a lot more time to get committees to look at them, and a lot more time to finesse what we want out of those bills. The other good news is, of course, we have spent hundreds of hours, and a lot of you have been instrumental in that work, building a knowledge base, a larger base of knowledge for members of Congress. Considerably more members of Congress know about the OMP profession, know about what we're trying to do with that bill. I mean, we're talking hundreds of legislators now instead of, the 4 or 5 or 6 champions that we have relied on previously in the past. And again, that's a work that all of you have done by reaching out to your members of Congress through our policy forum, through our mails, our email campaigns that we send out. You have helped make that happen, and it puts us in a much, much better place early in the next Congress. And then, of course, none of us can predict what's going to happen. None of us could have predicted COVID. I firmly believe that were it not for COVID, we could have gotten this bill done this year. It's just that things sometimes happen. But all that to say, unless something that wildly unpredictable happens again, we're looking at a more normal term of Congress, much more opportunity for regular order, a lot more opportunities to get the bill done. So we did everything we could to get it done this year. Again, we still might be able to get 1 or 2 facets of that bill over the finish line. But no matter what happens, we are very, very well positioned to get that bill done early next year, or at least start on it early next year and work on it solidly for the duration of Congress. Real quickly, a couple of other things that you're going to see us working on in the 117th Congress. I've talked about this a little bit. Is we have always gone for legislation, congressional initiatives, federal something within the cabinet, within the VA, within HHS, within the DoD, to boost the O&P workforce. We know we are looking at a workforce shortage, so we will not stray from fighting for that to alleviate that in Congress. We are going to be doing it in a bit of a slightly different way. In the Wounded Warrior bill that we've done in the past has its fair set of issues. We've always received pushback from the VA on that bill, so it is not a legislative path that we're going to take in the 117th. Instead, we're going to look to, among other things, boost minority representation in the O&P workforce. This is something that is incredibly important to the Biden team. It's incredibly important to the Congressional Black Caucus, who have a lot of sway with the agenda in the House. So we have already started talks with the Congressional Black Caucus and the Biden transition team on ways that we can not only boost our workforce, but reach audiences and develop new students to our profession, educate folks about our profession in ways that we haven't done before. So this will be a very big goal of some of the things of our workforce angle over the next year. We won't give up on boosting additional funds for the existing O&P master's programs. We are still working closely with Senator Durbin on that. And that is something that they are very passionate about, which is great for us. They want to get it done, so we will obviously do everything we can. But boosting that O&P workforce and bringing a more diverse O&P workforce is something that we're going to be focused heavily on. And of course, ensuring veterans' choice of O&P providers. This is an issue that always creeps up. It's one of those things. Once a month, maybe twice a month, we'll find out that some veteran who had been seeing a practitioner who was contracted by the VA can no longer see that practitioner, or the VA is trying to meddle in some way in that relationship. It doesn't happen all the time, but it happens frequently enough that we are obviously concerned about it, have been concerned about it, talked to Congress about it. We have talked to the VA about it. And so that is something that we will focus on a lot as we go through the coming year. So let me stop there and see if folks have any questions. We are at about 1:27 because I talk fast. So let me pause there, see if anybody has any questions, comments. I would love to hear from all of you. In fact, let me put up, real quick, before I open it up for questions, the next webinar is January 20th. Please mark your calendars. These are we're doing these webinars monthly, as we will be throughout next year. So look forward to everybody's participation, but did want to put up my email address because if anybody wants to get more involved, if anybody has any questions they don't want to ask here, by all means, reach out to me at that email address. So with that on the screen, I will pause to see if anybody has any questions or comments before we sign off.
Hey, Justin, so after we finish the vaccine conversation, someone had also asked, what about administrative staff, or is that part of the group we're looking to
Yes, yes, it is. They're just as, it's not just the practicing O&P, it's anyone in your office is considered a frontline worker. So yes, they are eligible to be in the first round. Again, it varies state by state. If you have a question about your individual state, reach out to me and we'll get it settled. We'll find out where you're supposed to go and what you're supposed to do. But yes, that does include your administrative staff.
Great. And then there's a question about the next webinar. It's Wednesday, January 20th at 1 p.m. And we'll be sending out communication at the top of the year about that. And we'll actually, in that communication, go ahead and include the next couple that we have scheduled in 2021.
Yeah. And we will
inauguration. You are exactly right. Someone just noted that we were during the inauguration. We might have to rethink that date. Thank you for framing that.
What better time to have it, really?
Right. No, so sorry. You are dead on about that. We will. We have not publicly announced this, so we will rethink that.
And then, I mean, for us in DC, normally that would be a very big schmoozing going around the Capitol and doing our lobbyist thing day, but I can't see that happening in the midst of a pandemic. There's going to be a very, very scaled down inauguration. So we will change the date on that one. Thanks for pointing that out. But I don't know. The point is I probably could do it from home if I wanted to, because I'm not going to be doing the usual DC schmoozing thing that day. But anyway, thanks for pointing that out.
Give it a few more minutes. Any other questions for Justin before we close out today's webinar?
And I imagine by that date, we will also have the date or dates of our policy forum. I use the word dates because, what we did this year, obviously, when it's been a fly-in event in DC and folks have come to DC, we've had it, one day of education and learning. The next day we go to the Hill. One thing we're learning that every group is learning is in the midst of moving to virtual events, and the policy forum will be virtual again next year. Despite the fact that a lot of folks on this call, hopefully a lot of us will be vaccinated by then. We're not going to run the risk. So we're probably looking at several events over the course of a few weeks, which will involve direct contact with Congress. We'll set you up with meetings and tell you how to make your own meetings. It'll be a little more interactive, a little more proactive than what we did this year with the letter writing campaign. Now that we've all got our pandemic legs under us and we know how to do this stuff online, it'll be a very different look to the policy forum, but I look forward to telling you more about that next month.
All right, Justin, I'm not seeing any more questions at this point.
Excellent. Again, if anybody does have any questions, thoughts, comments, please do reach out. Everyone have a very, very safe and very, very happy holiday season, and I look forward to reconvening with you next month. Thanks all.